A very good evening to all of you. Myself, Sharat Chandran, Professor, Apex College of Nursing. Today we are going to discuss about a topic which has been very prevalent in our society, that is scissors. So what is scissors? Scissors is a condition in which the brain, there is abnormal electrical activities from the brain that results in the changes in the perception of the client, that may changes in the perception of the client's behavior, movement, as well as there may be loss of consciousness. So, as you all know, brain sends the electrical signals to communicate with the spinal cord, to communicate with the nerve and the muscles, or within itself also. These electrical impulses are generated by the brain in an orderly, organized, and a systematic manner. So, in scissors, what is happening? These electrical impulses are generated abnormally, and it may cause because of various causes. Causes and etiology, as you all know, scissors is the causes of scissors is still unknown, but there are various etiological factors that contribute towards the scissors, such as transient ischemic attack. So, what is transient ischemic attack? As you all know, cells and tissues of our body needs two things that is primarily necessary to survive. That is glucose as well as oxygen. So, due to cerebral blood flow cessation, this blood as well as oxygen is not being supplied to the tissues and cells of the brain, which led to the transient ischemic attack. Second is any kind of blunt trauma or head injury. So, head injury and blunt trauma will also leads to scissors. As you all know, there is a difference between scissors and epilepsy. We will continue the causes, but before that, let me introduce that scissors is something different and epilepsy is something different. As I have discussed about the scissors, so what is epilepsy? Epilepsy is a condition of recurrent episode of scissors. You cannot call it an epilepsy if there is single or isolated seizures occur. That means epilepsy is a condition in which there is recurrent episode of seizures. So how you can call a client or a person may be suffering from epilepsy? There are three ways you can identify a person who is suffering from epilepsy. First one is your jerky movement. Second one is loss of consciousness, then sensory phenomena. So these all are the factors that are held as a responsible factor that eventually leads to epilepsy. So we were talking about the causes. So as I told you, transient ischemic attack is one of the causes of leading to epilepsy. One is blunt trauma. As you all know, why blunt trauma used to occur? Blunt trauma used to occur due to brain injury. So what is happening? For example, if you are driving a car and this car hit with a sharp object, and this sharp object penetrate into the skull onto the dura mater and bruises your brain tissues or lacreate your brain tissues, which eventually leads to cerebral perfusion or increase in the intracranial pressure. So increase in the intracranial pressure causes cerebral tissue perfusion. So due to cerebral tissue perfusion, your blood pressure will be raised or high, and eventually it may lead to a condition called epilepsy or seizures. So another factor is any kind of infection. Infections such as meningitis, infections such as viral infections such as HIV, that is human immunovirus, which eventually leads to a condition called AIDS, that is acquired immune deficiency syndrome. So infection is also a causative agent for causing you a seizures or epilepsy. Then like brain abscess is there. Then another conditions such as I discussed you like regarding dementia. Dementia is also a cause for causing seizures. Dementia is a uh, cognitive impairment. So cognitive impairment means your logic, your reasoning, your judgment is being disturbed. So In cognitive disorder there are two types of disorder, that is dementia and delirium. So due to dementia, due to Alzheimer disease, you have heard about Alzheimer disease. It is very much prevalent amongst the older generation or old age group. So Alzheimer is a type of cognitive disorder which eventually leads to epilepsy or epilepsy or seizures. So we will discuss about the pathophysiology of seizures. So till now we have discussed about what is seizures and what are the causative factors which eventually leads to seizures. See, let me introduce about the incident rate. But actually, starting from the video, I have said that it is one of the most prevalent disease. It is the most prevalent neurological disorder which is prevalent in our society. In India, about 2.5 to 12% population suffer per thousand population suffer from epilepsy. So you can able to assess that this is one of the most prevalent diseases that has been there in our society. See, the epilepsy symptoms may show in very early ages, and it may subside or subtile during the middle age, and it can again regain its tendency in your older age. Now, as you all know, uh, during the time of seizures, our cerebral oxygen consumption increases. So, during the time of seizures, the oxygen consumption in our cerebral arteries used to increases. So, as you all know, the oxygen demand is being less because due to ischemia. Why it is caused because of ischemia? It is caused because of ischemia due to transient ischemic attack. So, ischemia causes blood flow cessation. Blood flow is being not flown in a proper direction. So as you all know, blood contains hemoglobin, and one hemoglobin combines four atoms of oxygen. So when there is ischemia, there is inadequate supply of the blood, which eventually leads to reduce number of oxygen, reduce amount of oxygen to the cerebral tissues, and this cerebral tissues or brain tissues used to destroy through the means of this scissors. Now we are going to see about the pathophysiology which is associated with seizure. As we have discussed earlier regarding the etiological factors such as transient ischemic attack, any kind of dementia, then we have traumatic brain injury, brain abscess, then we have hepatitis, oh sorry, HIV, and the hepatitis also, then HIV, AIDS, or meningitis. These all are the etiological factors that contributes towards the seizures. So, due to etiological factor, what is happening? Due to etiological factor, the brain neurons, the neuronal cells tries to fire the impulses at a very abnormal rate. The neuronal cells in the brain tries to fire the impulses, yeah, tries to sense, yeah, try to transmit the electrical impulses at a much faster rate. The amplitude is very much high. So due to which what is happening, due to which these neuronal cells are trying to send these signals, they're trying to send these electrical impulses in a much faster rate, eventually lets the adjacent neurons to engulf it. See, in which the adjacent neurons try to engulf it, and due to which seizures is usually occurring. Understood? So this is the pathophysiology which is associated with seizure. So due to etiological factor, neuronal cells that is there in the brain used to fire the impulses. As we all know, the brain sent the signal to spinal cord for the process of communication, not only spinal cord but also nerves and muscles, so they can communicate within themselves. So here what is happening, due to etiological factor, the neuronal cells used to send the signals, yeah, due to transmit the signals, yeah, due to discharge the electrical impulses in a much faster rate. So what is happening? These neuronal cells are sending the impulses or firing the impulses at the first faster rate, and it reaches a threshold in which these neuronal cells that are transmitting the impulses engulfs the adjacent neurons also. Understood? So it engulfs the adjacent neurons also, which leads to a condition of seizures. So this is the pathophysiology which is associated with seizures. Now we will see the types of seizures. So primarily seizures can be classified according to the age of onset, according to the causes, and according to the abnormalities of EEG. So age of onset is there, cause is there, then we have abnormalities of EEG, that is electroencephalogram. See, seizures can be classified into two types. First is your partial seizure, and second one is your generalized seizure. So what is the major difference between partial seizure and generalized seizure? The major difference between partial seizure and generalized seizure is that the, the neurological abnormalities are in a limited specific area, that is in partial seizure, and the neurological abnormalities it's spreading whole throughout the cerebral hemisphere. This is the major difference between partial seizure and generalized seizure. Partial seizure means only a specific part of the brain is being involved in discharging the electrical impulses abnormally. And in generalized seizure, what is happening? In generalized seizure, the whole cerebral hemisphere is being involved in transmitting the electrical signals at a much faster rate, at a much higher magnitude, and at a much higher amplitude. The whole cerebral hemisphere is being involved in the generalized seizure. Now, partial seizure can be again classified into two types. First is simple partial seizure, and second one is complex partial seizure. So what is simple partial seizure? What is complex partial seizure? We will see in later. Right now I am going to describe about the generalized seizure also. So as I told you, partial seizure can again classified into simple partial seizure and complex partial seizure. Generalized seizure can be classified into various types. So first one is your absence seizure. First is your absence seizure. Second one is your myoclonic seizure. Third one is your tonic seizure. Fourth one is your clonic seizure. Fifth one is your tonic clonic seizures. And the sixth one is your atonic seizure. Atonic seizures. Tonic clonic seizure can be called as grand mal seizure. It is another name of tonic-clonic seizure, which is called as grand mal seizure. So now we are going to discuss about all these seizures. So first of all, we will discuss about the partial seizure. So as I told you, what is partial seizure? Partial seizure means any kind of neurological abnormalities that is limited to a particular part of the brain. It may be your frontal lobe, it may be your occipital lobe, it may be your parietal lobe, or it may be your temporal lobe. As you all know, there are four lobes in our brain. So the parietal is there. So what is simple partial seizure? Simple partial seizure means here the neurological abnormality. Here what is happening? Here the neurological abnormalities in which the electrical signals, the electroencephalographic changes show that the neuronal cells are firing the electrical impulses from a specific part, from a focal part. Understood? That is called as your simple partial seizure. The major difference between simple and generalized seizure is that in simple partial seizure, there is no loss of consciousness. But in generalized seizure, there is loss of consciousness. So in simple partial seizure, there is no loss of consciousness. मतलब कि आपका कोई कॉन्शियसनेस लॉस नहीं होगा, देयर इज नो लॉस ऑफ कॉन्शियसनेस. Simple partial seizure have various clinical manifestation that defines that this is a simple partial seizure. For example, motor manifestation. In motor manifestation, as you know, your fingers and your hand represent your cerebral representation, means it is one of the largest cerebral uh, representation. So what is happening in simple partial seizure? What is happening in simple partial seizure? Your upper extremities get have a convulsion. So it primarily affect the upper extremities, but after few times it may involve your central extremities as well as your whole limbs. Then comes uh, somatosensory manifestation. In somatosensory manifestation, if the temporal lobe is affected, for example, from the any kind of electrical activities from the temporal lobe may leads to smell or taste. So we are discussing about the somatic sensory manifestation. So in somatosensory manifestation, as we were discussing like that, if the temporal lobe is been associated, there may be changes in the smell and taste. If the parietal lobe is been affected, then there may be your tingling sensation, your numbness. Then if occipital lobe is been affected, then you may have vision disturbances. And if frontal lobe is affected, you may have memory loss. So in temporal lobe, you can find psychic manifestation also. The patient or the client may develop psychic manifestation also. Now comes generalized seizure. This we have completed simple seizure. And second one is also there, complex seizure. So what is complex seizure? In complex seizure, there may be loss of consciousness. As we have discussed that generalized seizure is the condition in which there is loss of consciousness, but in parietal seizure also there is, right now sir, partial seizure also there may be loss of consciousness in the complex seizure. Understood? So what is complex seizure? In complex seizure, the patient may involve in involuntary movement or gestures. For example, like the patient is not intentionally involved in any kind of involuntary movement, such as patting onto the legs, such as lip smacking, such as lip smacking is there, patting onto the legs. So involuntary movement, yeah, putting fingers onto your nose. These all are unintentionally the person tries to do this kind of behavior, and eventually, if someone notices that, he or she may think that he may be mentally disturbed or having some kind of psychic manifestation. So a close monitoring enable us to assess that this is not a psychic manifestation. This is eventually because of complex partial seizure. Complex partial seizure patient or client may experience antisocial behavior also. So it is very difficult for a nurse or it's very difficult for a health professional to control the patient. The patient may agitate, the patient may be irritable, and the patient may loses their patients due to this kind of seizures. That's it. Generalized seizure. As we had discussed about the complex seizure, now we are going to discuss about the generalized seizure. So generalized seizure account about one third of the seizures. That means in generalized seizure, there may be convulsive movement or there may not be convulsive movement. In generalized seizure, how you can classify it as a generalized seizure? How you can identify, how you can diagnose a patient or a client is suffering from generalized seizure? So in generalized seizure, there is loss of consciousness and the neurological abnormalities. The electrical discharge from the brain is engulfing the whole cerebral hemisphere. That means this is a kind of generalized seizure. So as we have discussed that generalized seizure of six type. First one is your absence seizure. Second one is your myoclonic seizure. third one is your tonic seizure, fourth one is your clonic seizure, fifth one is your tonic clonic seizure, and sixth one is your atonic seizure. So one by one we are going to discuss about the all these type of generalized seizures. So first one is your absence seizure. So how you can identify a patient with an absence seizure? Yeah, the patient with an absent seizure usually have a period of abrupt staring. The patient used to stare, and it is he used to stare for a longer period of time. There may be lapse of remittance also. He used to stare for a longer period of time. So this is how you can classify an absent seizure. Then comes myoclonic seizure. Myoclonic seizure is a type of seizure in which there is involuntary jerky movement of the neck, jerky movement of the face, jerky movement of the arms. Understood? So myoclonic seizure, how you can diagnose a patient with a myoclonic seizure? In myoclonic seizure, the patient may have jerky movements. For example, if you give a coffee to that patient who is having a myoclonic seizure, he will spill that coffee onto the bed, and he will say that his arms are shaking. For that reason, the coffee or a tea is being spilled onto the bed. So this is called as myoclonic seizure. Third one is tonic seizure. So what is tonic seizure? In tonic seizure, there is muscle contraction and muscle relaxation for a longer period, lasting several hours. There may be contraction of the muscles as well as there may be relaxation of the muscles. This seizure also have a condition of jerky movement. The patient may experience jerky movement onto the arms, onto the face, onto the neck. There may be muscle spasm also. Understood? Then comes your clonic seizure. So what is clonic seizure? Clonic seizure also is a condition in which there is involuntary jerky movement. Understood? There may be involuntary jerky movement also in the clonic seizure. So we were discussing about the clonic seizure. As we have discussed that clonic seizure also have a jerky movement. Here you may find there is muscle contraction in the muscles, which eventually leads to clonic seizure. Then we have tonic clonic seizure. Tonic clonic seizure can also be classified as grand mal seizures. Here is what is happening. The entire circumference of the cerebral hemisphere is being involved. Means the electrical discharge is being the electrical discharge or the brain send the electrical impulses whole throughout the cerebral hemisphere. So a patient with tonic clonic seizures uh, eventually loses the consciousness at the same time when this seizures has been occurring, and it may last for about 2 to 3 minutes and maximum about 5 minutes. And then comes atonic seizure. Atonic seizure is a type of seizure in which there may be muscle weakness. Yeah, your muscle strength get loose during the time of seizures. So thank you very much. I hope you may find this video uh, interesting. I hope you will share, subscribe, and like my video. I will educate you people more throughout this video. And if any kind of a suggestion you want to give to me, you can suggest also, you can comment also, and please share and subscribe my video. And thank you very much.